Hello and good afternoon, Allied Nation. Welcome to today's edition of AMN Allied Live. I'm your hostess with the mostest, Rachel Kilmer. Thanks for joining me. And before I get to introducing my most amazing guest, let me go over some housekeeping items for you. First up is always make sure to check out our AMN Passport app and website for the latest and greatest jobs. Also get connected with a recruiter if you haven't done so already. If you are one of the lucky viewers watching this right now, don't forget to drop those questions and comments right in chat, and we'll get to them as soon as possible. You can also check us out on the Instagram at AMN Allied. And last but not least, we also still have our most amazing blog contest going on. The link will be dropped in chat, so you can click on that little link there and you'll be able to view the details, but some serious cash to be earned there for, again, our blog contest going through till the end of this month. And without further ado, in alphabetical order, just for my OCD purposes, let me introduce to you my guests. So first up, we have Bria.
Hello, I am Bria Wilcox. I have been a speech language pathologist for the past 5.5 years, and I've been with AMN for all 5.5 of those years. I have worked with pretty much every population from pre-K all the way up to high school, and I've also have some clinical experience as well. A fun fact about me is that I am obsessed with Taylor Swift, and I get to go see her not once, but twice next month. So I'm very excited for that.
Woo-hoo. Swiftie. And next up, Jill Pantel.
Hi, everybody. My name is Jill. I am a manager of recruitment on the schools team with AMN. I've been in this role for about 4 years, working with clinical fellows the whole time. And a fun fact about me is that if you get me on the phone and you want to talk about Bravo or Star Trek, we'll be best friends.
A Trekkie. I guess, what do they do, right? Is that the Spock thing, right?
No, I think that's a gang symbol.
No, that is not a gang symbol. No, I swear. What's the Spock thing? Oh, it's this. I'm sorry.
Yeah.
I'm not a Trek fan. I just gave myself away I'm not a Trekkie. And last but not least, Maggie. Introduce yourself.
Yes. Hi, everyone. My name is Maggie Keys. I am a clinical manager at AMN, and I have been with AMN for almost 4 years, and I am an SLP by training, and I won't mention how long. It's been a very long time that I've been in SLP, mostly in the schools, but I've done a little bit in acute, home health, skilled nursing, etc. So my fun fact is I am a real redhead. I'm a natural redhead.
I was gonna ask, is it? But thank you guys so much for joining today's episode. Like I said, we're talking about clinical fellows, clinical fellowship, best tips and best practices. So listen up, because the information is going to be really good on this one. So without further ado, let's just get this whole kit and caboodle started. So Jill, how about you start us off and tell us more about our clinical fellowship program that we have with AMN?
Yeah, I'd love to. So just to keep it brief, anytime I'm on the phone with a new graduate, a future clinical fellow, I love to describe our program as really being comprised of 4 components. So the first one is the supervision aspect. So we're very hands-on with making sure that you're partnered with the best supervisor possible. It's going to be someone who's vetted through our clinical team, making sure that they have the time and the desire, the dedication to give to you during your clinical fellowship year. Second piece of that is we offer free and unlimited CEUs through MedBridge. So you have all of those, required CEUs taken care of, as well as any additional that you want to take on. We also, as a third portion, offer reimbursement for a medical certification. So if a more medical placement is where you picture yourself down the road, we can reimburse you for the cost of completing your modified barium swallow certification, fees. There's a couple other to choose from that I'm sure your recruiter could walk you through, but that's available to you. And then the last portion is reimbursement for your ASHA dues. And that can be about $750 for your first 2 years. I know that first one's a big one. It's about a little over $500. So we'll reimburse you for that. So that's pretty awesome too.
Yeah, those reimbursements, they come in handy, right? Right, Bria?
Oh, yes.
And turning it over to you, Bria. So since you are the one that has traveled through your CF, tell us why you got into travel and what was your experience like with that?
So my whole plan after grad school was I was going to work in clinic and I was going to live in Nashville because that's where my parents were. And I love Nashville. Who doesn't love Nashville? So I got down there that summer and there were no jobs for CFs there at all that I could find. So I reached out to AMN, to a recruiter, and my recruiter hooked me up with a job in North Georgia. I'd never been to Georgia before. I was terrified. So I called up my good friend Lauren, who was in the same situation, but in Pittsburgh. And I was like, hey, do you want to just like move to Georgia with me? And she was like, yeah, sure. So I referred her. I got an awesome referral bonus, which, very nice, especially when you're fresh out of grad school. And we came down to North Georgia and it was a great CF year. We made so many friends. There were quite a few of us that traveled down from AMN that were CFs. I think there were like 5 or 6 of us, and we just had the best time that year. We traveled around. And we all still keep in contact. We have a group that we text back and forth if we ever have any speechy issues or just, guess what happened to me today in this session type thing. So it was a great CF year traveling. Highly recommend.
That's awesome. So some really great takeaways there is buddy system. So if you have a good friend that you feel like you could travel with and stay in the same room with, definitely go for it, because traveling with a buddy, it's already, a really big new experience. So you have somebody to lean on and do that experience with, but also referral bonus. Hello. So really great way to earn some extra cash, referring over friends, but also you get to travel with them as well. Really cool deal. So thank you for sharing that. So exciting. Ugh. I would be so nervous because I'm like, Mom, Dad, where are you? So it was cool that you got to do that with a friend, though.
Mm-hmm.
All right, Maggie, next question for you. And just again, a reminder to our viewers, please go ahead and drop questions and comments in the chat. This is definitely the group to ask anything clinical fellowship related or even just speech in general related. And they'll be able to answer for you from a travel perspective as well as a clinical and, direct therapy perspective. So Maggie, next question for you. Expectations for a clinical fellow within a travel assignment. What do those look like?
Sure. So I think the number one thing is really understanding what ASH's requirements are, since they'll be the ones that will be giving you your Cs after completing your CF. So going to their website, they have a wonderful website where everything is clearly listed out. So really knowing it inside and out, referring back to it as much as you possibly can, using their resources as well. They have a lot of helpful resources to keep you on track throughout your CF. Number 2 is also knowing your state licensing requirements. So, after finishing your CF and then moving into like having your Cs, if you're staying in the state, there could be a change. If you're going to a new state, understanding what those, rules and regulations and everything surrounding licensure, it's important to know. And the third aspect I would recommend, as far as like expectations and managing, just your CF, is communication, making sure you're reaching out to your CF mentor with anything and everything. They're there to support you in your growth as an SLP. And they want to support you. That's the purpose of being a mentor. And having been a mentor myself, I love talking about any cases or specific cases, questions surrounding process, any of those questions. It's so much fun. So reaching out to your mentor. But also, if you're working with AMN, you have a recruiter, you have so many different layers of support that, are great to tap into.
Yeah. So on the topic of support, directed towards you, Maggie, and you, Jill, being on the clinical and the recruitment side, what are the best practices on our end to make sure that we are giving proper support to our clinical fellows?
Yeah, from the recruitment standpoint, recruiters wear a lot of hats. We kind of take any questions or concerns that you may have. And, if we don't have the answer, we can direct you to the right person. And in cases where you have clinical questions, that person would be Maggie. So, we're there to support you for the business side of things and also to direct you to the right person for more clinical issues.
Yeah, and we're here, clinical management team, myself, my colleagues, we're here to really help you through anything. If you want to bounce ideas off of us, if you do have questions or concerns about what's happening at your site, that's what we're here for. And the cool thing is all of our contact information is listed in AMN Passport. So if, when you're on assignment, you have a dedicated clinical manager and their contact information is on the AMN Passport and you can reach out directly to us. Or like Jill said, go right to your recruiter and they can direct you as needed.
Yeah. So good time to name drop again, but AMN Passport website and app, go ahead and check it out. Available on Android and iPhone. So it's not one or the other, but it is such a great and growing technology that we have for job notifications. And when you're on assignment, like Maggie said, all the information is at your fingertips. Bria can attest to it. And it really is just an amazing application. All right, next question. So Bria, let's go to talking about best practices. So, tips to give clinical fellows when they're starting out on their trek as not only just a traveler, but starting out in their clinical fellowship.
So some good tips for that is to definitely talk to the school district you're going to be working, hopefully for. Ask them, what is my caseload cap? Also, what types of populations are going to be on my caseload? And it's also important to ask workload versus caseload, because your caseload might be really high, but your workload might not be quite as bad. You might have a lot of consult kiddos. So those are all really important things. It's also really important to have good communication with your recruiter. I have an awesome one. It's Rachel. And also to ask how they're going to support you as a new SLP, because not only are you a new SLP, you're also new to their district. So even me going into a different district, I still would have a lot to learn, even though I've been an SLP for 5.5 years. Every district is very different. So those are all really important. And trying to reach out to different SLPs in your district or maybe different SPED leads in your district to kind of get a little bit of a helping hand. That's also super helpful.
Yeah. So you had mentioned, talking about caseload and stuff. Let's flip to the topic of clinical fit. So again, talking best practices, what are the important questions to cover during the interview process when clinical fellows are interviewing for whether it's a school or a medical position?
So things you could ask are just, am I going to mostly have kiddos who are artic? Am I going to be working with medically fragile kiddos? If you're working with more medically fragile kiddos, you're probably, and you really want to do like clinic or hospital setting, that's going to look really good on your resume. You're probably not going to have any problems getting a clinic setting if you want the year after your CF, if you have that experience with kids with different needs, for sure.
Awesome. So you had mentioned, not having difficulties getting a job in a medical type setting after completing a school year for your clinical fellowship. So I'm going to turn that question over to Maggie and Jill, so you guys can talk more about, that misnomer that's out there. If you complete your CF in a school, you can't go into medical. So, so Maggie and Jill, if you guys could talk on that topic for a little bit.
Sure. I can even speak from experience. I started out in the schools, and a couple of years later, I shifted to a rehab facility that had inpatient and outpatient. And so there are various ways that you can really move to a different setting. You are not pigeonholed by any stretch of the imagination just because you do your CF in one setting. So even if you do your CF in a medical setting, that doesn't mean you'll never be able to work with peds. There are definitely ways in which you can, slowly start working in one of the other settings different from the one that you start out in. Yeah,
Cool.
not stuck.
Yeah, not stuck. So Jill, turning that question over to you, why, schools are more, I guess, advantageous to complete your clinical fellowship, and, compared to a medical setting. Not saying that medical is not doable, but why is it, good to go with schools in terms of wanting to achieve those requirements for your CF?
Yeah, I mean, there's a couple great reasons. I mean, the first one logistically is contract length. So, the length of a school year is pretty much perfect as far as getting all of your hours done for your clinical fellowship. In addition, the support piece is just kind of incomparable, typically between medical and schools. If you consider a medical placement, yourself as well as your supervisor likely have productivity requirements that they're having to make. Whereas in a school, not only are we able to be more hands-on with selection of a supervisor, but it's going to be someone who has a little bit more flexibility in their day to give to you. So, and that, as our CF program has grown and developed, one of the things that we've added was that reimbursement for a medical certification. So, like I mentioned before, if you see medical being your long-term goal, but, are looking at the possibility of completing your clinical fellowship in a school, that can be, a great addition to your resume to help facilitate that transition down the road.
Yeah, definitely. So, so schools, like I said, definitely more advantageous in regards to completing your, all of your requirements in a one and done type of assignment. Whereas medical, it might, get complicated just if the facility is not open to you completing a longer contract. Then you have to possibly change supervisors. And so it can get a little bit more complicated, but still doable. So, one thing I wanted to mention, because we're talking a lot about the CF program, you can also visit our website. The link will be dropped, and the QR code is posted on the screen as well. But you can visit our site and find out more details about our clinical fellowship program. And again, get connected with one of our awesome recruiters. And man, are they subject matter experts? Yes, I can confidently say that. We know CFs. Okay, so next question. And just again, reminder to anyone viewing, please go ahead and drop questions and comments in chat. We want to hear from you. So anything clinical fellowship, speech related, we're here for you. So Bria, next question. Because you've had to wear both hats doing on-site and teletherapy. So what have been the differences for those? And in regards to teletherapy, do you recommend that for clinical fellows?
I definitely do not recommend it for a clinical fellow.
Okay.
That would be very difficult. I feel like being in person, you kind of learn a little bit more what type of therapist you are, I guess. I do use a lot of boom cards in my sessions, so teletherapy works for me. But if you're more hands-on, you want to play more with the toys, play like board games and stuff, then that's probably not going to work very well, especially for your first year, because grad school, you learn so much. And I mean, I remember in grad school, I always had a supervisor over my shoulder. This is your first chance to go out and really like do your thing and learn how to be a clinician. So yeah, teletherapy for your CF probably I wouldn't recommend it.
No go. So you have over 5 years of experience. So what has been, now that you have that experience under your belt, what has been your favorite? Because you had to do teletherapy, when schools were not on site.
Right.
So, what were the differences there in terms of treatment?
You definitely got to learn a lot about the families.
Okay.
It was very interesting to see the kiddos in a more home environment versus school for sure. And I got to know those parents so much better too, which was actually really nice and fun. Yeah. But in school, I feel like at least at that time we got more speech done when we were face to face, but that's not, teletherapy is very different now than it was then. But
okay. So really great question all right, Lainey, we got a question from Lainey. Thank you, Lainey. All right, Bria, what's been your best experience working as a speech pathologist?
Oh my goodness, there's so many. I think just whenever I have a little one that is like just starting to talk and like they don't talk at all, and then I get them and they start to speak a little bit, there's like no better feeling. I always tear up every time, like guaranteed. The first time I hear like a little kid say go, or like the start of like put on, I'm like, oh, yes, like that's what I'm always in it for. It's just the beginnings of seeing that transformation. It's so exciting.
Oh, I love that. So question two, and I'm going a little off grid here. Okay. So just bear with me. Question to Maggie and Jill. In terms of requirements, because we're talking everything clinical fellowship here now, we're just putting it out all on the table. So in terms of OSHA requirements, what are the top requirements needed for a clinical fellow to complete in order to get their Cs?
Oh, good question. Testing my memory here. So your hours are number one. You have to have a certain amount of hours for the entire 9 months, and it has to be 9 months. So you can't speed up the process by doing extra hours in 1 week versus another week. It has to be pretty consistent. You have to have 3 segments, and then within those segments, you have to have a specific amount of supervision, direct and indirect, from your supervisor / mentor. So those are pretty strict guidelines that you need to be following throughout your CF. And then just how that direct and indirect works, making sure you're following the ASHA guidelines and state guidelines, because state guidelines can be a little different than ASHA. So making sure you're following both. I can't think. Jill, can you think of any other?
No, I mean, I think you pretty much covered it. I mean, from a numeric standpoint, it's 36 weeks, 35 hours per week. And again, most of our contracts are more than 35 hours a week, but it still has to be 36 weeks minimum. So
yeah, very cool. Yeah, sorry, had to tap in that memory bank for you, Maggie.
Let's a little bit.
We have another question in chat. Thank you so much, Andrew. So I'm assuming this is directed to Bria, but or actually, no, sorry. My apologies. This is going to be more towards Jill. What is the best part of the CF program? Well, actually, it could be for Bria too. What is the best part about the CF program that we offer with AMN?
I can go first. Oh. Okay, go ahead. No, Bria, go ahead.
Okay. I think for me, just like totally going somewhere I did not expect to go and having an incredible experience, like being in a new area. I think it's so important personally to like get out of your hometown at some point in your life. I don't know. I think that that's so great and exciting for you. Like I met my fiance here. My friend Lauren, I was talking about earlier, she met her husband. Like it's great, not only like career-wise, but personally. I think it's such a great reset to go out of grad school and just kind of start on a new path.
Yeah, absolutely. And then, Jill, in regards to our clinical fellowship program, what do you think is the part of it that gets leaned on the most from our clinical fellows?
Without a doubt, I would say the support piece. I mean, it's just really like beyond just the supervision aspect. I mean, you have your recruiter, you have contacts on site, you have our clinical team, you have potentially other travelers within your district. There's just a lot of layers of support that are hard to replicate elsewhere. So that's always what I'm most excited for my clinical fellows to experience.
Yay. Yeah.
I fully felt that support all through my CF year and beyond. So fully back that up.
Excellent. Yes. Yeah. The support system, whether just being a new grad in general and, leaving the nest, it's different. So to know that you have people to lean on, yes, they are from a distance, not necessarily right around the corner, but it's good to know that you can rely on us on the back end for that support. So really cool stuff. Let's see. I got to be a little creative here because we're a little light on questions. I was expecting more questions, but I do have to say you all have been very informative. So tricks on me here. So for clinical fellows, when is it time? And Bria, this can be a good question for you. When is it a good time for them to start deciding what they're going to do to start their clinical fellowship year?
I think after you pass your praxis. That's what I did. I kind of waited to pass my praxis, and then after that big weight is off your shoulders, you're a lot more free to be like, okay, let's start job hunting now that I can actually be a speech therapist. Like, because I just remember that was so stressful. That whole summer, I was just a mess. And then I passed it and I was like, all right, I just like got so much clarity. And I was like, I'm going to be a traveler. Let's go.
Let's go. So what got you, I'm just digging a little bit more into you, even though I already know these answers, but what got you into speech pathology to start?
Well, I feel like it was just kind of predestined because my mom worked at a learning center when she was pregnant with me, and one of her best friends there helped her spell my name phonetically because she's a speech therapist. So I've just always been around speech therapists my whole life. And I wanted to be a high school teacher for the longest time. And then I was like, I don't know. And then my mom was like, you should be a speech therapist like everyone else, And I was like, you're right. And I fell in love with it. It was just very natural.
Oh, thank you. Okay. All right. Now I have to pronounce a funky username. Okay. ITCMDR Hunter. Thank you for the question. What are some of the biggest challenges the typical CF will face on the path to their Cs? So really that's a question for the whole roundtable to answer. So biggest challenges that the typical CF will face on the path to their Cs.
I mean, initially, I think it's just sort of making the decisions about what you want your clinical fellowship year to look like. Are you open to travel? Do you want to stay close to home? What settings are you considering? I mean, that's kind of like the first step on that journey, figuring out what that ideal or, what your goal placement would look like.
Cool. Bria, what do you think? What were the biggest challenges you faced?
I think, AMN makes it really smooth, not to like talk y'all up too much, but I think just making sure and triple checking I had all the hours. That was the scariest part for me. So I was like, am I going to submit it and everything's going to be wrong? But no, it was great. It was pretty smooth, honestly. That support system, I had a great supervisor and my recruiter was great. And yeah, it made it a really smooth experience.
Awesome. Maggie, I'll turn that question over to you because on the clinical side, I'm sure you hear some of the challenges that people face during their clinical fellowship. So tell us a little bit, I guess being a little more vague, not too specific, on those challenges that you've had to help resolve.
Sure. I think Bria mentioned, some of the experiences I've had when supporting clinicians. It's when it's coming up either like halfway through or even towards the end, like, how do I calculate this? What about, hours per week and all of that. So that's definitely come up. I think sometimes it is caseload, but in regards to there might be some shifting in the middle of a school year. They may ask, a district may ask if you can either take on, a couple more kids, or they may just shift your caseload to, a different population. So when you're a traveler, when you're a contractor, the name of the game is definitely flexibility, because when you're a CF, you're still learning. And so it could be a great opportunity to really, learn a whole new population, learn how to work with another grade level, different academics that, are being intertwined with the goals that you're working on with your students. So it may feel like a challenge, but I think looking at it as like from a growth mindset of, hey, it might be hard, but that's okay. We're going to learn from this and, take what you learn, and it can help you grow into, what you choose next after your assignment's done, after your CF is done.
Excellent. And what was the transition? What's the transition like going from, so your CF requirements are done, now you're going to get your C's. Is it like snap of the fingers, you got your C's? Like, what's that process like?
Bria, do you want to talk about your process?
I mean, it's a blur. It was you submit all your paperwork, and then they send you this lovely letter saying, congratulations, Bria Wilcox, CCC, SLP. We are pleased to announce you are officially a speech language pathologist, fully certified. I don't really remember beyond that. I think it is pretty quick. Once you submit all your paperwork, they get back to you fairly fast. So it's a big weight off your shoulder. Like, it's so much pressure off.
Yeah, I like to ask that question because after all of that, to go through another painful process to finally get your C's would just, it'd stink. It'd be awful.
Really, I think makes it pretty, they've streamlined it. So I think it's really
probably a lot easier now than it used to be.
Lainey, so for your question, it says, do CFs get any benefits? Are you talking about medical benefits through the company? I just want to make sure we answer that specifically. So yeah, just let us know what kind of benefits you mean, because we do offer tons of benefits. Just want to make sure I'm answering that correctly. But just again, a couple reminders, we're going to be wrapping up here shortly. So if you have any other last minute questions, now's the time to ask. But just some great reminders here, clinical fellowship, whether you want to go into a school or a medical setting, the support system is definitely here with AMN between our clinical team, your recruiter, and then, of course, the supervisor that you're assigned to. Another great reminder, if the facility or the school does not offer supervision, we at AMN can provide a supervisor from our network of supervisors. And I can tell you, they're all great. Bria is one of them. So yay.
If you come to North Georgia, you might get me. You never know.
Yeah, exactly. And then the QR code popped up again. So feel free to visit our webpage to talk or see more of the points on our clinical fellowship program, because it really is great. And I always like to re-mention the unlimited CEUs through MedBridge. If you are in a school setting, but you want to stay up to snuff on medical stuff, sign on to MedBridge, take some free CEUs, keep yourself fresh on the medical side. So it's a really good thing to have. All right, Lainey, I think I understand. So I think you're talking about medical benefits. So for travelers in general, as long as you are of a certain age, and you are not married, so if you are of a certain age, so I believe it's 26 for most, I think it's across the country, or if you have gotten married before you turn 26, then you have to be responsible for your own benefits and come off your parents. But we offer medical, dental, and vision benefits. We also have a 401k program. And you can, definitely find out more if you get connected with a recruiter. They can provide all that information and then some on our great benefits that we offer. So, all right. Any last minute thoughts, y'all?
I don't think so.
Not that I can think of.
Yeah. I think we spewed it all out there. Whew. All right. So clinical fellows, hop on board. That's the point here. But thank you guys so much for joining me, you three, especially for sharing the minds. And then also for our viewers tuning in as well. And of course, just a big thank you to the healthcare professionals that are out there. Bria, thank you for everything that you're doing. Maggie, thank you. Because without you, this relationship wouldn't be possible. And of course, our biggest point, our patients would not have the care that they need, whether they are big or small. And then just another couple reminders, AMN Passport, if you haven't visited it yet, it's pretty awesome. And you can also check us out on Instagram at AMN Allied. Our blog contest is still live through the end of this month. So the link was shared a little bit up in the chat there. But again, thank you so much for tuning in, and we look forward to seeing you all again next month on our next Allied Live. All right, that's all for now, guys. Bye.
Bye. Thank you.